One of the things that has been making the rounds on social media for the past several years are, videos of nurses who are behaving poorly, have bias towards their African American clientele. Hi, my name is Dr. Natalie Jones. I'm a licensed therapist. One of the things, again, just kind of reiterating that a lot of people, a lot of Black women have been speaking up loudly about is racism and bias and just poor treatment and healthcare treatment that actually affects whether they can live or die or not. Um, and when you have nurses, and I'm sure a lot of us remember just late last year, the lady who was in labor with her mother there, and she was screaming, and the nurse was just like, "Yeah, whatever," and like just treated her. She could not care less. That lady was an inconvenience to her, and she couldn't be out of that room fast enough. We saw the lady with the woman in COVID who was neglected by her nursing staff there in the hospital ER, tried to call 911, and then basically videotaped herself dying, while in the ER. There is so much bias and discrimination in healthcare. Healthcare for many is already unaffordable, inaccessible, or you have to wait long periods of time to get to it. But to experience, to 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 try and get it, and then by going to the hospital, by going to the doctor, by doing the simplest thing for yourself, and then to be treated like you're not a human being, like you're not worthy of care, you're being made to suffer. Because that's the other thing that they don't talk about, is that a Black patient and a white patient could be sitting next to each other in the same room. White patient is going to be more likely to get pain medication for their pains, whereas a Black patient is not, and they're going to be told that you might be drug seeking if you're asking for something, so they're quick to do these things. Sometimes you're not even spoken to. You're not, you just don't get common courtesy. Your concerns may also be dismissed, or go unnoticed, or you may be described. There's the WWW acronym, for white women who seek out medical care and complain, the whiny white woman, as they call it. I shudder to think what the acronym is for Black women in healthcare, or even Black people in healthcare, who express over and over that they have concerns and they're not being heard. There are racial disparities in healthcare, and there have been many studies done on this. And it doesn't matter where you are. You could be in the most diverse city. You could be in liberal California and still experience racial disparities in healthcare. And I'll use myself as an example. Um, I when I went to the hospital, uh, during COVID, and during COVID, it was this whole like protocol to go to the hospital. You have to, temperature check, wait, So I went to the hospital one night, and I was the only person there. So there was nobody else there. So there was an ER full of nurses, doctors, nobody seeing nothing. All the rooms are empty. So I go in, they give me the COVID test. I'm probably triaged within 5 minutes. Um, and I went in, and I'm telling the doctor what the issue is. The doctor is upset. She's upset as soon as she comes in the room. She has not greeted me. She's throwing around uh, tools, utensils, and she's not looking at me. I'm an inconvenience to her. So that's one thing. And the nurse is kind of looking at me, and and that's, but that, you know she's not saying anything, and they're kind of feeding off each other's energy at this point. Um, and just kind of whatever, doors not closed. Hey, what are you doing? So I got up out of there. She's like, you don't have any problems. Um, Throws a couple ibuprofen and says, get out of here. Turns out to be a much more serious issue, which I won't go into here, but it was, I was treated as though nothing was wrong. They prolonged health care and so on and so forth. And I have so many other racial examples of racial disparities I've experienced as well. Um, you know, I'll share another one. Last year, I went and got, might have actually been a couple years ago, but I had gotten sick, and, was very quickly just dismissed and triaged out of the ER, and was told that it's probably constipation, and there's just there's no bedside manner. There's no actually looking into the issue. It's more like you wait for hours and hours, and then, or you wait and then to be told there's nothing wrong, and then, it just prolongs like finding out what the issue is because you want to be triaged. And in that same time, excuse me, because you want to be treated like a human being. But also in that time when I noticed when I went to, what I forgot to mention, one of the things I noticed when I went to the ER is I'm sitting there and, you know, a black man is sitting there, and I don't know what's wrong with him, but he's in a wheelchair. The nurse had wheeled him out from triage. I guess he's like waiting for a bed space. And he's sitting there undressed, like he doesn't have on a shirt. He has on like little undies or something like that. But by and large, he's sitting there in a wheelchair and he's not coherent. He's just kind of laying to the side. And here he is in this waiting room with all of us. They just park him in his chair. I'm like, are you guys not going to put any clothes on him? Like, do you not? That's another thing is like, um, showing your patients decency, putting clothes on them, and things like. I used to work with this a lot when I worked in psych emergency. It wasn't necessarily with medical, but when police officers would bring patients into psych emergency, and they're not at their best. Sometimes they have a psychotic break or whatever, and they're outside with no clothes on, and they drive them all the way, with no clothes on. But you want to treat your patients with courtesy and respect, because people are not the best versions of themselves when they're seeking medical care. Um, and they deserve respect and decency, just as if it was your own mother, your own sister, your own father. And I think a lot of people forget that. They see skin color and things like that, and they're like, forget it. I don't care what happens to them. I don't care about speaking to them, or anything like that. Like I don't care about them getting treatment. They could die for all I care. I don't care. And then, yeah, I don't know. But you see it all the time, and I'm very concerned, for black folks, even people of color, um, to receive disparities in healthcare, because it can literally cost you your life. Anyway, thanks for listening. Hope that helps.